Nuclear power. Historically, nuclear energy has received a negative backlash for its destructive capabilities. Nuclear power was weaponized by the Americans and used it to turn the tide of the war. Death and destruction were synonymous with nuclear power. Only its destructive capabilities were known. On August 6, 1945, the US bombed Hiroshima.
History. Ever since the discovery of radioactivity in 1896 by a French scientist named Henri Becquerel, there has been a negative feedback from the public due to the damage it causes to genetics and empowerment of cancer.
Nuclear medicine. From diagnosis to therapy to cure.
Nuclear physics is a branch of physics that deals with the structure of the atomic nuclei. Serious and fast.
Nuclear medicine can be used in both a diagnostic and therapeutic capacity. As a diagnostic tool, nuclear medicine can help physicians determine a diagnosis or judge the effectiveness of treatment. As a therapeutic tool, nuclear medicine can treat some cancers and problems with the thyroid, among other conditions.
Nuclear medicine is the study of function of organs. The radioactive medicine is injected into the bloodstream. We use it to image the organs, and now they work and function.
For thyroid diagnosis and therapy, iodine-131 is used. In the Philippines, iodine-131 is found at the UST Hospital at España, Manila.
What do we inject? A radiopharmaceutical. It is distributed throughout the entire body. It concentrates on the diseases area of many diseases, such as cancer.
Usually, when we think of radiation therapy, we usually think of the empowerment of cancer and tumors. To counterattack the spread of cancer cells as well as tumors, radiation therapy is used, as radiation kills cancer cells.
In nuclear medicine, we can perform a WBC scan, a white blood cell scan. We take the blood cells of the patient, then we re-inject them to see where the tracer goes. Here, we will be able to identify and diagnose what exact disease or infection has taken place.
Here is an example.
WBC scan, that's a white blood cell scan. We tag the blood cells of the patient and we re-inject them. So we're able to see where that tracer goes. They did not know what was wrong with this patient. This patient had a fever and couldn't figure out what was wrong. And this was able to identify infection that they were unable to see with other diagnostics. I mean, really, it could have saved the patient's life. And that really made me feel good. And we really took part and helped.
A PET scan creates 3D images of the body. It does this by using radioactive tracers, which are usually administered to a patient through intravenous injection. The tracers are made up of carrier molecules that are tightly bonded to a radioactive atom called an isotope. The carrier molecule can interact with or bind to specific proteins or sugars in the body. The carrier molecule that will be used depends on what the doctor is looking for. If she suspects cancer or is monitoring a known cancer's growth, she may use FDG, a modified form of glucose, which gets absorbed by tissues. When tissues absorb a lot of glucose, it may indicate a cancerous tumor. The radiation from the tracers poses little danger to the patient since they quickly pass out of the body. The isotope produces small particles called positrons, which interact with surrounding electrons. This interaction results in the complete annihilation of both particles, releasing two photons that speed off in
Cancer therapy can be much more effective using a new way to optimize nuclear medicine treatment. The process could also be useful for other diseases that could benefit from targeted radiation. Targeted therapy with radiopharmaceuticals has great potential for the treatment of cancer, especially for cancer cells that migrated from primary tumors to lymph nodes and secondary organs.
Where do radio tracers come from?
With an on-site cyclotron, our chemists and research physicians have made personalized medicine diagnosis a priority. With these techniques, we can diagnose disease earlier and customize the treatment for each patient.
We have chemists that are specialized in synthesizing small molecules and tag them with radioactive atoms that's just synthesized from the cyclotron.
Are there any risks?
Nuclear medicine is a byproduct of nuclear energy, which is nuclear power. Now, we use nuclear medicine for treatment, diagnosis, and cure. So here are our main purposes. However, there are side effects. Think of this as an area of cells in the body. Now, here are cancer cells. Radiation therapy, we target it for treatment. However, sometimes the entire cell wall or the cell area will be affected and radiation will kill all the cells in the area.
What makes my profession different is that we get to play with a lot of technologies. Right now we're in the forefront of fusion imaging, which is combining CT with nuclear medicine, MRI with nuclear medicine.
Well, I've always enjoyed what I do, and I think it probably is more because of the closeness that you can have with your patients. You have a real rapport with the doctors that you work with also. And again, you work with cardiologists.
Boy.
One. Sige, magpa-practice mo na.